and welcome to this week's Fibro section. I'm shooting at a bit of a different angle today, if you hadn't guessed. And of course my washing machine's just going to kick in just as I start filming. So let me shut the door, hang on. Yeah, I thought I'd shoot a different angle, and it's in the bedroom obviously, so that's a bit different as well. I just thought I'd mix up where I film these Fibro sections so you're not always watching me from the same place all the time, because I don't want it to get boring. And please let me know if there are any Fibro sections you would like me to film or look into or research more of a topic, or even something outside of Fibro that you'd quite like me to do. Maybe go and do what do you call them, like a come shop with me at B&M or Home Bargains or a supermarket. Let me know what you'd like me to film, because I'm just here to please all of you. So yeah, please let me know about that. Obviously body allowing going shopping, but of course I could do it at some point. So let's get on with this week's Fibro section, and here is the trusted notepad. And guys, my trusted notepad is getting very full. Look, can you see? This is all the, oh no, you can't see. This is all the full bit, and this is what I have left. Hardly anything. So you know what time it's going to be? It's going to be time for a new trusted notepad soon, which is good because I'm going shopping with Poppy soon, so I shall pick one up. So this week the Fibro section is on tinnitus. So tinnitus is the name for hearing noises that are not caused by an outside source. The main symptom is a noise such as ringing or buzzing. It's not always clear what causes tinnitus. It can be linked with hearing loss or other conditions like Meniere's disease, anxiety or depression. Ear problems are common in fibromyalgia, such as feeling of ear fullness, earache and tinnitus. And guess what? I suffer with all of them. I'm like such a classic Fibro case, I tell you. It's usually my right ear that's affected, but I do get tinnitus in both ears. But the fullness and the earache is usually in the right ear. It hurts now actually. Many nights I wake up because I sleep on my right side most of the time. I do swap occasionally, but I can't sleep on my left side long because of my hip. So I sleep mainly on my right side, but it wakes me up with the pain in my ear just from laying on it. So I do, and I suffer with earache a lot during the day as well, and it's always usually this one. So scientists have looked into the connection between chronic pain and tinnitus and found what appears to be central gatekeeping system implicated in both chronic pain and tinnitus. Tinnitus can be intermittent or constant. The volume can range from very soft to painfully loud, making it difficult to concentrate and sleep. There are several sources which are known to trigger or worsen tinnitus. Noise exposure can damage hair cells, and once damaged, the cells cannot be renewed or replaced. So you really need to look after your ears and your hearing. And I know this because, let me put the book down for a minute. Poppy, those of you that know, suffers with auditory and memory processing disorders, and she has no hairs on her eardrums. She was born like that. So that was found out from Great Ormond Street Hospital, and it means that any noise that impacts her ears is gonna damage her eardrums. So she has to go for annual hearing tests. Now Poppy suffers a lot with tinnitus. She gets it a lot. So it's obviously there's that connection with the hairs on the eardrums, and she has to be really careful. So like obviously she's a drummer, so she has to wear like special earplugs when she plays the drums to protect her ears. But yeah, it's obviously connected that way, isn't it? So head and neck trauma can induce tinnitus as well. Certain disorders such as hypo or hyperthyroidism, Lyme disease and fibromyalgia can have tinnitus as a symptom. Treating the disorder can help alleviate the tinnitus. So like treating your fibro, treating the Lyme disease, you know, treating the hyperthyroidism. Certain types of tumours, wax build-up, jaw misalignment, cardiovascular disease can all trigger tinnitus or make it worse. And there is no cure for tinnitus, unfortunately. However, in some cases, it can be managed by treating the underlying cause. So consult with your doctor to learn of possible ways to manage it. Tinnitus can be a side effect of medication with antidepressants. So a lot of medication and pain relief, or just medication in general for fibromyalgia, has been used in the past for antidepressants like amitriptyline. That used to be used for antidepressants. It's not now, but it used to be, and that can be a side effect, tinnitus, of that. As a result, it is really important for fibro patients who suffer from tinnitus to closely monitor and track their treatments. It can help to pinpoint the cause of new or worsening symptoms. Now, I'm hoping I'm going to say this right. Pulsatile tinnitus is a rhythmical noise that usually has the same rate as the heart, which is easily checked by checking your pulse and seeing if it's the same time as listening to your tinnitus. With pulsatile tinnitus, the chances are more likely of finding a specific cause, but it is still difficult. It is due to a change in blood flow in the vessels near the ear. It's quite interesting. I never knew anything. I only thought there was one tinnitus. I didn't think there was a different one. For some, treatment with low doses of anti-anxiety drugs such as Valium or Elavil can help reduce tinnitus. Also, the use of a steroid placed into the middle ear along with anti-anxiety medication has been shown to be effective for some people. There is retraining therapy, where you can wear a device that masks ringing with tonal music, gradually training you to ignore the sound. So that's quite interesting, and I guess if you're interested in any of these things that can help tinnitus, it's definitely best to ask your GP and see what they say about it. Guess what else? Guess what else? Diet. It's always diet. Avoid salty meals, processed sugar, flavour enhancers like MSG, and fatty foods. You could try applying a warm compress or heat pad to your ear too. Reduce or quit smoking and alcohol. Avoid taking aspirin, and be regular with exercise. I mean, I know a lot of people with fibromyalgia say, no, I can't exercise. I'm a classic case of it's just moving your body. So I'm not talking about a full-blown workout, as you all know. It's moving your body. So stretching, stretching is the best one, I think. And I will link for you my stretch videos in the description and above, and you can check them out afterwards if you haven't seen them already. Right, where am I? Turmeric extracts have a positive anti-inflammatory response in ear conditions, so that's worth knowing. I take turmeric supplements. I have done for many, many years. See your GP if you have tinnitus regularly or constantly, or if it's getting worse. Also, if it is affecting your sleep or concentration, or it's making you feel anxious or depressed, you must seek help. Don't just let it ruin your life, because it can be a horrendous thing. For those of you that have suffered with tinnitus before, the ringing in the ear, I don't know about you, but usually when it happens to me, one ear goes completely dead, so I can't hear out of it, and then you just get this piercing ring. But luckily mine only lasts for a few minutes at the most. It doesn't last very long, so I'm lucky, but I know a lot of people suffer with it all the time. You know, to have that ringing all the time must be horrendous, and I would say get help. Listen to all the things that I've said that might help. You can try some of them on your own. Some of them you'll need help with, to be referred maybe to ENT, but definitely get help with it, because it's miserable. It's the most frustrating thing. So all the do's and don'ts of tinnitus, you need to go onto the NHS website, and I will link it in the description for you, so you can have a look there at what they say about tinnitus. Hope this week's Fibro section has been helpful to you in some way. Definitely hit that thumbs up if you've enjoyed it, and subscribe. If you're new here, hit the subscribe button and the little bell so you won't miss one of my videos. I post a Fibro section or similar on a Wednesday, and on a Saturday I upload the weekly, which is just part of my crazy life. So definitely come aboard, subscribe, and leave me a nice comment. Let me know if there's anything you've tried for tinnitus that's worked for you. Let me know if any of these that you're going to give a go, or if you're going to speak to your GP about it. And I will see you all on Saturday for the weekly. Take care of yourselves, and knowledge is power. Don't forget, I love you lots. Bye.